us today. I'm Colleen Turner, Development Director for the Bellevue Schools Foundation. And you know, we certainly do live in challenging times as we struggle with feelings of social isolation. You know, every day I try to think of something that I'm really grateful for. And today I'm thankful that you joined us so that I can see at least some of your smiling faces and make a personal connection. You know, we adults are having a difficult time coping with COVID, so you can imagine how hard it is for our students. Many teens are missing out on some of the biggest moments of their young lives, as well as everyday moments like just hanging out with friends and participating in classroom discussion. So fortunately, the Bellevue School District had the foresight a couple of years ago to implement a program that screens and identifies students with mental health issues and gets them the help they need. And Bellevue Schools Foundation supports this program with funds raised from our generous donors. This afternoon, Corinne Bowen and Jared Taylor will speak about the district's mental health assistance team and the Signs of Suicide curriculum and how they are helping our students cope with COVID. Corinne Bowen is Bellevue School District's Director of Counseling. She manages the mental health assistance team, all elementary counselors and social workers, and shares supervisory responsibilities for the secondary counselors and psychologists. Her focus is overseeing mental health and student well-being. Corinne leads the district's crisis response management and works closely with community partner agencies that deliver mental health services. Jared Taylor is Bellevue School District's coordinator for behavior interventions and mental health services. His primary roles are leading the mental health assistance team and coordinating the Signs of Suicide intervention in the district. Jared supports staff with students experiencing high intensity behavior challenges, provides professional development in behavior interventions and mental health, and serves on the special education leadership team. If you have questions during the presentation, please put them in the chat box. And so now, please join me in welcoming Corinne Bowen and Jared Taylor. You can take it away.
All right. Chris, did you want to start or did you want me to?
No, you can go ahead and start.
Okay, let me go ahead and share my screen here. And we'll get started with a presentation here. And hopefully you can see my screen. Is that correct? Okay, great. Let me go ahead and minimize that. And I'll put this into presentation mode. So thank you for having us. I am super excited to be here today. Can't say enough how appreciative I am for the Bellevue Schools Foundation and all of you for being very supportive. I mean, last year's contributions and support helped a lot of students, and we're continuing to use the resources that are being provided to us to help even more students. And so, again, you're doing great work to help us. It's amazing. So what we wanted to do today was to show you kind of where the resources are going, and just to make sure that you have a good understanding of what we're doing. Clearly, with the current situation with COVID-19, it's created some challenges, significant challenges for us, and obviously the students and parents are in our community. And we'll touch on how we're kind of working with that, as well as just the overall systems in place. This process really is about trying to make a systemic change in the way we provide mental health services. So there will be some content that is a little bit theoretical, and we'll keep it light and move fast through that. But I also want to make sure that that you know that a lot of this is grounded in science and kind of how we're trying to make sure that we're using the best practices possible. So let's go ahead and start, and just going to go over what we're going to talk about today. Corinne and I are going to talk about is we're going to talk about a rationale for our new framework. Why a few years ago, as Colleen mentioned, we kind of changed how we're starting to do mental health services. Hasn't changed completely, but we're in kind of a 5 to 7 year implementation plan. talk a little bit about what the Signs of Suicide program is. So research background information on kind of the new framework. Talk about the theory of action, how it works, it's intended to work, what our goals are, how we've been implementing, what results we're seeing, and then kind of what successes. Okay. So whenever I give a presentation, I like to kind of frame the problem and as to why we're doing what we're doing. And so the rationale for why we're doing SOS and this new MHAT framework is that you can see that about 20% of all children are experiencing mental health disorders. This is pre-COVID. I suspect this is higher. We do have some local results. I'll talk a little bit about those later on, what's going on with that. It is higher than 20%. It's lower than what I expected, but we'll talk a little bit about why that might be. Obviously, we want to intervene early because what we find is that those mental health issues continue into adulthood as well. And so we want to make sure that as a school system, we are supporting our kids early for early identification and being able to provide a good service delivery model. And unfortunately, there aren't a lot of good service delivery models out there right now. Because as we see that only about 20% of students of that 20% overall actually get services or get adequate services. And lastly, lots of times when kids do get the services, the tools and the techniques that they're using are not based in science. They're based in kind of more how kids kind of report feeling and how people kind of think that they should go. It's not based in kind of research. So something I think actually I think this is Corinne, this is you.
Yes, it is. So do I have to do anything to be able to show up on can you hear me okay?
I can. I don't know about anybody else, but
Okay, awesome. So I just want to echo what Jared said earlier about the appreciation to the Bellevue School Foundation for supporting the work that MHAT and SOS and being able to support our kids. So I want to start off with that. And I also want to start off by letting you know how appreciative I am of Jared and the MHAT team, even though I've only been working with them for a very brief time, just the start of the school year. I have seen just and amazed at what a great team it is. It's a very cohesive team. They're very professional. They're so organized. The team members are the MHAT counselors and Jared, just so passionate about the work that they do. And it just is exciting to see. I know that with, this formula that we have and all of the passion that the MHAT counselors and Jared is doing, we know that we're going to, they're going to be doing great things for kids. And I'm really excited to be a part of this team. But what I'm here to talk about this afternoon, in addition to sharing all of that with you, is kind of giving you guys an update. This is, reports from the MHAT counselors as they're doing the SOS and the BIMAS 2, collecting information about what they're generally seeing during this time with kids. What are the concerns? And they are reporting, the MHAT counselors are reporting that they see dysfunctionality in sleep. So, lots of kids are staying up really late, unfortunately, maybe getting a few hours of sleep and then getting up to be ready for school, which they're probably groggy and exhausted and tired. And then taking naps in the middle of the day, which then obviously messes up their sleep cycle again. So we are, they're definitely seeing that. They're seeing, the eating habits are, not eating healthy and not keeping a good exercise schedule, or regular exercise schedule. So those are some of the things that the MHAT counselors are reporting, in addition to the next two things I think are really, really important. They're seeing that the kids are reporting that they're feeling lonely and invisible, and they're expressing more anxiety and depression, and they're feeling lower now than they ever have. And we obviously as adults know that it has a lot to do with the fact that there's the social interaction has been eliminated almost, right? There's very few social interactions and social opportunities. So they're feeling really socially isolated. So those are all of these feelings of anxiety and depression that could come up because of that. And these kids that we identify as having these feelings are encouraged to attend the resiliency class. And I'll explain a little bit more about that when we get to that point. We also the MHAT counselors are reporting that students are relying more on online relationships for social interactions. And sometimes those are not always, safe and healthy. They're oftentimes exposed to more suicidality and violence and other unsettling content. So something for us to obviously be worried about, but that's the only social interactions that they're able to have during this time. They are also, the MHAT counselors are reporting, the online bullying and the sexual harassment is pretty much a universal experience for a lot of students right now because they're online 100% and have access to 100% of the time on the computer. So it's pretty, that's why they have more access. Can you advance to the next slide, Jared?
Sure, I can advance to the next slide.
Okay, and then continuing on with the MHAT counselors report, kids are definitely feeling their family's economic concerns. We have students that are, having to help out with their families by taking a part-time job and maybe not being able to focus as much on school. And we all know that this is really real right now with our families. And so the kids are also feeling it. The other thing that our MHAT counselors are also reporting that students are experiencing is it's just, the anxiety and the stress of, are they going to get COVID, right? But more importantly, they're worried about giving COVID and affecting those at higher risk, that may be living in their home. So that's another worry for our students. And, overall students are expressing a lot of family strife and, with their parents because they're there 24/7. There is no break, right? There's hardly any break. Before school was the break for students and parents. And so, and a lot of times too, parents are trying to restrict their kids from doing, participating in certain things and because they want them to be safe, and kids are rebelling and control against that control. So the MHAT counselors are seeing all of these things as they are working with students, but we wanted to just kind of give you a summary of those concerns. Jared, if you can advance. Our MHAT counselors are also seeing some racial equity concerns. I know this was one of the questions that was raised in the, I guess there was an opportunity for you to put your questions forward before we had the presentation. And I know there were questions about racial equity and how are we addressing our students of color. And we are definitely, the MHAT counselors are seeing that our students of colors are definitely having more intense reaction to, of course, the Black Lives Movement and the protests, looting, all of the election stuff, all of the things that we're seeing on television as well. So it is definitely affecting our students of color. And then, oftentimes too, some students are at odds with their parents because they necessarily do not share the same political views of or ideologies of their parents. So that can definitely make it hard, especially during the election time. We were seeing some of that with our students. And then, just parents wanting to restrict the social interactions in fear that their child of color will experience prejudice or unsafe situations in the community. And that oftentimes is leading to a lot of stress and anxiety for the kids as well, because there's just that conflict. So that is what our MHAT counselors are reporting. Our other significant group that is being affected during COVID is our LGBTQ students. And our students that are LGBTQ students that are, especially if they're not out to their family, are having a really even more difficult time because there is no reprieve, right? Used to in the past when we were in the building, when they were in the building, they were able to, express themselves, their identity and their views openly at school, and had the opportunities to do that. But now that they're at home, it's really difficult to do that, especially if their parents are unaware or if their parents have very conservative views. So it's just, and they're not being able to express themselves. It is definitely causing a lot of our students of LGBTQ to struggle with their feelings of inadequacy and worthlessness. So we're just really, glad that the MHAT member counselor is working with our students, especially this particular student. I know that, our MHAT counselor who is working with this particular student is very, very concerned and very, very passionate about trying to figure out ways to help this student. But I'm just glad that that MHAT counselor is there to support the students in the times that they need it. And then what are we doing to help? I am not going to go in depth on the SOS. Jared will do that by Mass 2 screening. He will do that, and he'll talk a little bit more later on in regards to MHAT counseling, but I will just spend a few minutes telling you about our resiliency classes. It's a wellness and resiliency groups. I don't know if some of you have kids that attend Bellevue School District. You may have received some of these advertisements or opportunities for students to get additional support. But we have a wellness and resiliency group that just started this past Monday, and they meet every Monday from 12 to 1 from now until a winter break. And and they have really great topics. Our first session was on Monday, and we had 18 students join, which I know it doesn't seem like a lot, but it's just, I have a feeling that it's going to continue to grow as the word gets out that that students can come here for additional support. We also started and kicked off the community mental health forums yesterday afternoon. We did the anxiety one, and Jared was a part of that, and we covered anxiety. Today, we have the same topic. It is going to be about anxiety, but it is going to be delivered in Mandarin at 3:30, and then at 5 o'clock, it's going to be delivered in Spanish. So we're hoping that the community comes to find, attends these community forums and gets the help or the questions answered that they may need regarding how to look for signs and more importantly, how to reach out for help. But these community forums are going to be monthly. They're going to be a different topic every month. So next month in December, we are already have in place planned for a depression topic and discussion for the community forum. And then in January, a relaxation one. And these are going to be continuing for the community all the way up until the end of the school year. I'm really excited. We just started the in-person drop-in counseling services. We started that this past Tuesday, and we are going to continue it until, whenever we're back in the building. But if the reason why we started the drop-in is we know that some students are not doing well and will not participate in virtual counseling. So this is an opportunity for them to show up on a Tuesday or Thursday. It's drop-in, so there's no appointments needed. From 12 to 4 o'clock, there will be either a counselor, social worker, MHAT team member, or a behavioral health specialist there to support them and to do one-on-one counseling with them. So this is available for our students as well. And it is for our 6th through 12th grade, so secondary students. And then, of course, we have the normal counseling that's available through our school counselors. So all of those things are available for our students currently to support them.
All right. And speaking of the in-person services, I'm at Highland right now, actually helping out with that. So if I hopefully won't get called away, but if I do, you'll know. But we have adequate coverage or good coverage here to handle that. So I'm going to talk a little bit about our Signs of Suicide program, which Bellevue Schools Foundation supported significantly last year in purchasing the curriculum, as well as paying for the coordinator position that was held by Rich Brown last year. Rich Brown has gone on to become an administrator, and I've taken over the reins of coordinating the Signs of Suicide. And the Signs of Suicide program is an evidence-based practice. So there's quite a bit of research to show that it is very effective in helping kids that are expressing suicidal ideation. And it's focused on helping students recognize behaviors associated with risk, suicide risk in themselves, but also in others. And they use an acronym called ACT, which is Acknowledge, Care, and Tell. And the idea is that if a student is expressing concerning thoughts and ideas, is for the students to acknowledge that they're feeling down, that it is actually suicidal talk, to provide some sort of care to help them, provide empathy and support, and then to tell a trusted adult, preferably a school counselor or somebody in the mental health profession, but certainly telling an adult that can access the help as well. And what we've done is that we've delivered this through the 7th and 10th grade health classes during their mental health units. And at the 10th grade, we pair this with the BIMAS 2 screener. And the BIMAS 2 is the behavior intervention monitoring and assessment system. And I'll talk more in detail about that and show you some results. We use the BIMAS 2 screener for the mental health assistance team to analyze the data there and provide services to those students that are showing a need and are interested in those services. We also use a screener, we did in the past, a screener, the BSADS screener. It's a brief suicide screener for 7th grade. The Signs of Suicide group is not recommending that we do that. I'm not sure exactly why. I'm going to reach out to them a little bit and find out why that is, because it's possibly just because the access of getting to students if they do express signs of suicide. At the high school level with the BIMAS, we do have an item 24, which does look at thoughts of hurting oneself, not necessarily suicide, but hurting oneself, which could be interpreted as suicidal ideation. And we do have a protocol to handle those students if we hear that they are reporting that and that we can't get a hold of them. We do have a protocol how to deal with that in a timely manner. So far, at the first semester, almost all of the schools have implemented the signs of suicide lesson so far at the 7th and 10th grades as well. So let's jump into the MHAT a little bit, the mental health assistance team. And we'll describe a little bit about what it is, but I wanted to start by just showing our mission statement. And it's really to identify students with mental health needs, provide a full spectrum of evidence-based mental health services delivered by highly trained and skilled Bellevue School District staff, and to enrich student well-being. And really, our vision is to promote and support mental health for each and every student. So where did MHAT come from? What I can do is give you some more information about that. It stems out of some research that I did while I was at the University of Washington getting my doctoral degree in special education. And looking at the literature and doing literature review, what I found is that we have a lot of outside professionals, YES, Sound Mental Health, Consejo, all these agencies, and they're incredibly important, and we will continue to partner with them because there is an extreme need. We need all the help that we can get. At the same time, a lot of schools don't have good frameworks to set up good systems about how to provide support in kind of an efficient manner. What we find is sometimes schools ask for assistance, and then we kind of, what I call, throw people at the problem. We don't have good coordination. We don't have good supervision and consultation systems set up in place to produce the best outcomes. And so there has been some disagreement in the community that schools should not be, or should not, the counselors, school counselors, psychologists, social workers should not be providing cognitive behavioral therapy or other evidence-based practices. And there's some research to show that it can easily be done by school staff, and that school staff can be very successful in doing that as well. What they also found is that sometimes school-based providers or employed by the schools have better knowledge of the school settings and have better they're more integrated into the school climate and culture. For example, a person who is a school counselor would know all the staff quite well, would be able to communicate with those staff on a regular basis, would be able to share information within bounds of confidentiality with teachers and other important staff related to kind of the students' progress and needs as well. So that's kind of some of the background on that. What I did also in my research is looked at what are the kind of how and when is CBT used, or evidence-based practice in mental health. Cognitive behavioral therapy is CBT. How is it used, and what are the factors that influence it being used, and what are some factors that cause it to not be used? And I did a survey of psychologists and counselors across the Puget Sound area. And there were 4 factors that really came up as significantly attributed to or correlated with implementation of CBT. And the first one was the role of the provider, and meaning that counselors were more likely to provide an evidence-based practice like CBT more than school psychologists. And the reason why we found was that school psychologists' primary role is oftentimes to evaluate students for special education services. And what I found was an interesting contradiction is that often the school psychologists are more trained in how to provide CBT than counselors, but yet they're being used less to do that. Another factor was that when people had a manualized version of a program, they were more likely to implement CBT, which is kind of not shocking. But what it says to me is that people who are doing this are using a tool that kind of reduces some cognitive load and provides them with some initial good training and support to implement that. The next one is probably one of the more important variables that I found, is that if a district is setting up resources and providing the proper structures, and not just time, money, and effort, but also verbal, encouragement and permission for staff to provide mental health services, they're more likely to do that. And then lastly, the perception of the practitioner about their skill level. So those people who felt more confident were more likely to deliver CBT, which is, again, kind of like the manual. It's kind of almost a no-brainer, but also very important when it comes to how do we increase their perceptions of ability. So for the MHAT, what we tried to do is we're going to try to provide more clarity for the roles and responsibilities of school counselors and psychologists and social workers in our district. We're not there yet with this. We're still trying to work on this. I think it's taking longer than I anticipated. This is a 5 to 7 year process, and I think we're only in year 3 at the moment, middle of year 3, and actually only 2. I'm sorry, no, 3. So we're going to be working on this. The next one is just providing manuals, which we're doing. We're doing that on a regular basis. And with the MHAT framework, we are marshaling time, money, and materials directly toward the initiative, and I've gotten a lot of administrative support and encouragement for this process. And then lastly, this is probably the primary role of the MHAT team right now, is to increase coaching, training, supervision, and consultation. So what is a technical assistance team? This is something that's been around for, over 30 years almost. And McAvoy and actually Carol Davis at the University of Washington was kind of a proponent of technical assistance teams. It's basically a small group of professionals knowledgeable about a certain disability or intervention or condition, and it's kind of related to a student need. And we in our Bellevue School District have had a couple of different technical assistance teams for years. We've had our major one is our autism technical assistance team. And that's been going on for about 15 years. So there's pretty good sustainability there. We've also had behavioral support, technical assistance teams as well. And essentially what they do is they provide consultation and coaching. And it's a team that doesn't have to be full-time. It depends on kind of the needs of the staff and then the students as well. And what we found is that there's definitely some evidence that having a technical assistance team is very helpful to, it's kind of a third tier kind of support for people who work directly with the students. These are our current MHAT team counselors. You've got Lane Barker, Allison Christensen, Megan Ferrick, and Vivian and Santa and Pei are all University of Washington doctoral students in the school psychology program. They're already certificated school psychologists, but they're all have gone back to get their PhDs. And what's great is Melissa Symes is also in that kind of cohort. She's been in our district for years, but she's created helped to create a great pipeline with the University of Washington, a good partnership, so that we've been able to get high quality people for relatively low cost. So we're trying to be as cost efficient with this process as well. So they're doing a great job. They're actually Megan and Pei are leading our resiliency class, which is Prince mentioned, and that's tied to a similar class at the University of Washington that a lot of freshmen take on. It's called DBT, Dialectical Behavior Therapy, and it's kind of a wellness class for freshmen as well. We also have Ruth Rosas, who's a counselor. She's been wonderful. She's our resident Spanish speaker and is doing the presentation tonight with, I'm blanking on his name. Yeah, anyway, I'm blanking on his name. She's doing it tonight. And then there's Alyssa, as I mentioned, and then myself. I'm the lead of the team. So the goals of the MHAT, I think this is the first bullet there is really the most important. We really want to increase identification of students. We want to find those kids that are suffering. We want to provide them with better access to services, get more kids to those services, and then also have better outcomes. And along with that, and with our equity challenges, we want to make sure that we're providing support for our students of color. We also want to make sure that, again, that we're using evidence-based practices. We want to encourage more school-based employed mental health providers, have more of those, by creating structures to kind of improve the service delivery model. And then, as I mentioned, with the technical assistance team, we're trying to increase sustainability. What I'm finding is that with a lot of this is that we're not going to be able to hire our way out of this kind of problem, likely, especially with our recent announcements about budget cuts and challenges. And so I think one of the challenges for us is to figure out how we can modify current job responsibilities that are not as focused on mental health, that are less important, or could be handled by people without a master's degree in counseling or school psychology, and kind of try and kind of focus that energy towards more mental health service delivery. All right. So what we're doing is with this process, again, I say 7 years, but it's really 4 to 7 to a while. It's taking a while, actually. The ultimate goal is to have at least one person in each school be able to provide mental health evidence-based practices. Could be more, but at least one person in each school in the district. Our first process in doing that is to kind of create what we call our district intervention team, which is where we are right now. This is a team, this is the technical assistance team, also known as that, and is the team of highly trained school psychologists, counselors, and social workers to be able to work out the procedures, the processes, and the materials. And that's kind of, we've done that part, and now we're in kind of direct service providing. Once the district intervention team is running smoothly, they've gotten even more skilled, then we'll scale back their direct service and focus more on supporting the school-based service providers. And this is, again, probably year 5 or 6. It's going to take a while to get through that. That's really, a lot of people are very appreciative of the direct intervention that they're providing, but ultimately the model of this, or the goal of this model, is to kind of be able to have that team do less direct services and be able to provide professional development, coaching, training, consultation services to the providers within the school. This slide here is just basically a graphic representation of that kind of rollout process. We're still in kind of, even though it says year one, we're still kind of in that phase where we're getting outside consultation and training for the district intervention team. And then eventually we're going to shift to, we're going to get rid of the outside consultation and training, and that the mental health assistance team will take on the consultation and training for the individual providers in the school. Right now, we partner with the University of Washington, Georgiana Sedlar, who's a professor there, who's an amazing instructor and teacher and therapist. And so we do weekly consult meetings with her. The team does, to kind of help us to develop our skills and become better at what we're doing. We also have partnered with Harborview Sexual Assault and Trauma Center to get training on one of the mental health evidence-based practices called Cognitive Behavior Therapy Plus. And then this is kind of the theory of action, kind of how this works. Essentially, is that the critical components of this are the supervision and consultation that we receive from the external provider. That goes to right now, it's going to the mental health provider is the district intervention team or the MHAT team members currently. And those people provide the services that they're learning from the external provider directly to the student, as well as to working with parents, teachers, and other school support staff. That's kind of the theory of MHAT in general. And so I think what we're going to talk about next is how to start a mental health assistance team, how we're doing it, and how it's been going so far. And I like this little slide here. This is my daughter having a snail race. She found some snails in the yard, and so she's setting them up. It feels like a snail race. But I am very appreciative of the district, of Bellevue School Foundation, and of Corinth for really believing in this process and sticking with it over a long period of time. It's very easy to let these things go, to focus attention elsewhere. And I really appreciate being able to kind of stay focused with this and keep going. So Corinth is going to talk about the costs.
Yeah, thank you. I just, want to echo again what Jared said. We're just very appreciative of your support. This is just to give you an idea of how much it's costing us right now as an overall budget to keep the MHAT team together and continuing. We obviously would love to see it grow, just like Jared said. Right now we're providing support for high school, but we would love to hopefully sooner versus later be able to have MHAT counselors at the middle school supporting the middle school students, and then eventually in the elementary school. So, but we just, want to give you an idea of, the overall budget and just, how much we appreciate your support, because it means a lot, especially in this current, just what Jared just said earlier. We just got an email from our superintendent notifying everybody, that the district, that we're going to have like a $30 million cut for next year. So, we obviously don't want this to be the thing that gets cut, because it is doing great things for kids. And we hope that everybody continues to support this cause.
Is there anything else you want to say on that one, or pretty self?
No, you could in advance. Thank you, Jared.
Okay. So let's talk about what happens, how it works. There's kind of 5 phases to it. I'm going to not speak too much of the screening and the data analysis part. I'll show you some of that information, but I want to talk about like what happens. How do we identify the kids? Once we've identified the kids, what goes on? How do we intervene with them? And then what happens after we're quote unquote done with the students? So I'll kind of go through that a little bit. After we've provided the screening using the BIMAS 2, we do kind of a one-on-one intake interview. with the student. And we've already met with the school counselors and other support staff to identify students that might be eligible for the services. And eligible essentially means that the student has a need, is not already receiving counseling services elsewhere, and is not in a special education program that already has social emotional curriculum or content delivered to that student. If a student is ambivalent, when we offer services to those students, we kind of use a motivational interviewing process, which is a kind of an evidence-based process to encourage support. I won't go into it too much, but it's a highly effective kind of process and tool to show kids that getting services can be helpful. If a student is interested, then we offer those supports. At that point, we complete an intake form for all the students, actually. And then if a student is not interested, then we will often provide other options. Maybe they do want counseling services, but don't want their parents to know that they're receiving services, or don't want to be receiving services through the school environment. We do kind of shepherd them towards other agencies and private providers as well. And as I said, this is where our partnerships with our outside agencies are extremely important as well. For those students who are interested in it and do want counseling services, we do need parent permission to do that. We have different laws that we operate under than community mental health. We operate under the FERPA law, which is the Federal Education Privacy Rights Act, as opposed to HIPAA. And we get permission from the parents and the students, and then we begin the kind of intervention process. Before we jump too far into the intervention process, however, is that we do kind of what's called an initial student assessment or a formative assessment. The screening tool that we use, the BIMAS-2, provides some basic information about what's going on for a student, but we use a variety of other tools to really get down into the weeds, kind of so to speak, about what's going on with that student. So we use a number of tools to look at whether there's anxiety, depression, conduct, trauma, other types of mental health issues as well. After that initial assessment, we can provide a feedback to the students and to the parents. We determine which kind of evidence-based practices or modules of the CBT Plus that we use. The counselor and the student kind of create some goals together, and we use a software program called EBP Toolkit to kind of monitor students' progress on those goals. We initiate the core intervention components. We start that, and then if there's further needs, we're monitoring the student needs or student performance over time. And if they're not getting better, then we might use different intervention components based on the needs of the student. And as I said, we progress monitor that and complete all the components. Once they've completed the components, we kind of determine what's next. So we do a kind of post-intervention assessment, which is those tools that we used. I mentioned up here, the GAD-7 CATs, all of those, to kind of determine, did the student get better? Are they feeling better about life in general and about themselves? The next steps after that is, if they are getting better, then we can kind of terminate services, exit them from the services. It might be that they're not getting better and that we want to do another course of MHAT services. And the thing I forgot to mention is that MHAT services are generally about 12 to 15 weeks. It's a short-term intervention. If students need more than that, we generally refer them to a community health provider for longer-term counseling or other kind of Bellevue School District resources. It may also, triage them if a student is doing well, but may want some follow-up. We might connect them with their school counselor as well. We note the decision kind of in our service plan, and then we kind of put those students back into the hopper for our universal screen. The BIMAS-2 also does have the opportunity to progress monitor students on a daily to weekly to every other week basis. So we can certainly do that. Let's see. Here's some kind of general information about what we've got this year. So these are the results of the BIMAS of this year. And again, it's been implemented in tandem with the Signs of Suicide program. And we've implemented it across the 4 comprehensive high schools. We are working on big picture and international, and those should be done before the winter break as well. The BIMAS 2 has 5 different kind of composite areas. Those are conduct. So those are more externalizing behaviors like substance use or acting out or kind of aggression, anger. Negative affect, which looks at more anxiety and depression. Cognitive attention, which is kind of those executive functioning skills like being able to pay attention to instruction, thinking of kind of metacognition, thinking about your own thoughts, time, time management, organization, things like that. Social skills, and then academic skills. And what you'll note there is item 24, which is the question about self-harm. And so what we're seeing is that clearly negative affect and cognitive attention, 35% of our students are experiencing either at risk or a significant level of anxiety and or depression as well. A lot of our students are also expressing difficulties with paying attention to school and to life activities, kind of activities of daily living in general. What we also noted there was that 93 students, or 16% of our total sample, which is 590 kids, you'll see there in our last bullet point, have expressed some form of suicidal ideation or thoughts of self-harm. We have met with every single one of those 93 students. Part of our protocol and our procedure is that when a student indicates on item 24 that they've thought about hurting themselves, either fleetingly or on a regular basis, our protocol is we meet with them within 24 to 48 hours, depending upon the severity, and we do a brief risk assessment. And for some of those students, it's become much larger risk assessment, where we determine that the student is at risk for suicide. And then we created a suicide intervention plan. And occasionally we have sent students to the hospital as well. And for those of you that were in our meeting last year when Deb Kraft was around, Deb and I mentioned that we had several students go directly to the hospital from this, and that it likely saved a few lives by doing this kind of screening. So I think it's really important that we are doing this. It's so critical. What we're kind of seeing as far as our current trends is that the number of students reporting concerns is down. I did an analysis of looking at last year versus this year, and we're about 10 to 15 points down, particularly if we look at negative affect. It was about 45, 44% last year, which is not what I would expect. Given COVID-19 and the anecdotal reports that we heard from our MHAT counselors at the beginning of this presentation. There's a couple of reasons why I think that might be going on. And what we're finding is that we're getting less students to participate in the screening, which is really kind of understandable, but also frustrating at the same time. We had about 120 students that should have participated in the screening that did not. They opted themselves out or didn't even show up for the screening process. It's likely that these are students that are probably disengaged from school. And it's quite possible that this population of 120 students or even students, other students, are actually experiencing a higher level of need of anxiety and depression, but because they're not showing up to take the survey, we're not capturing them as well, unfortunately. We have tried multiple kind of attempts to mitigate this problem and to catch those students. Our MHAT counselors have made multiple attempts, and and we're working in conjunction with the health teachers to contact the students individually to say, hey, we'd really like to take this survey just to see how you're doing. Some of the teachers have even provided as a graded task. It's a pretty easy graded task, so shouldn't be a problem. And then we also offered a large group retake, I think almost a week ago. Unfortunately, we still are down. I think we only got maybe 30 or 40 students from that 120 to increase. I ran the numbers before this, so I don't know exactly how many students that we actually picked up on this. There does come a point where we have to let go and stop kind of harassing the students. And we're trying to kind of walk that fine line of being persistent and supportive and helpful versus not being harassing. We are going to do a second screening in the spring, and we will probably continue to add those students.
Hey, Jared, sorry to interrupt. It's Corinne. I just wanted to be mindful that we have 8 minutes left before.
8 minutes.
Yeah,
Okay.
so we're going to have to hurry it up.
All right. Thank you. This year's services. So we're not, we don't know acceptance rates yet because we haven't analyzed those data. We're still in the process of offering those services to students because we just completed the screenings in early November as well. But again, one of the things Corinne may have said, I can't remember, but all of those students, so those 209 students and then the 93, which is probably combined there between negative affect and 24, are being referred also to the resiliency class. So a lot of those students may be also receive MHAT services. We're gonna skip ahead just a little bit because I think I gave this information last year. The student quotes I think are really important is that we're actually seeing successes. About 60% of our students from last year, because we don't have outcome data for this year, but last year, about 65, we saw 85 students last year, and about 60% of those students actually gained in functioning. They're doing better, which is huge. We don't typically see that level of success in a typical program as well. So I'm very pleased and happy, and that is all due to those MHAT counselors that I showed earlier. They're amazing superstars and really appreciate what they're doing to do that. Just to give you a brief kind of example here is what we're seeing. This is a student who was in the clinical level and in anxiety. And over time, we did some measures, and by the end of the time, so in 2 months, essentially, a little over 2 months, they went from at a high level, a clinical level of anxiety back down to normal. So we have other data here to show that as well. I think, Chris, this is you.
Yes, it is. I get to do the stories and the quotes from parents, which I appreciate you allowing me to do that, Jared. This is definitely something that we want to share with the Bellevue School Foundation. But this is just one quote from an email from a parent to an MHAT counselor, just their appreciation from the parent, thanking for the help and the support of the MHAT counselor in working with their students. So as you can see here, the parent is saying, working with you, he's processing things he can do when he feels hostile, usually basketball triggers. So giving other ways for the student to cope. And then just, saying that you're such a big part of helping align his heart with his problem solving so he doesn't suffer from feeling like his inside heart isn't aligning with his actions or feels lost in the social interactions. And they're just saying thank you for being a part of this journey with him. So just really appreciative of the support, the help that the MHAT counselor is providing to their student. Next slide, Jared. And then just a few student quotes to share with you guys as well. And this is just goes to show you that the MHAT team and their work is providing the space and the opportunity for students to open up. And I know that Jared and I've talked about this before. We, even in the virtual environment, We didn't really know how this was going to be with asking these questions, as far as, the questions about suicide, but we would rather know than not know. And we would rather ask the questions so that we can give students opportunity to tell us where they're at so that we can reach out and help them and figure out how to help them. So just quotes to share with you. And, quote number 2 is like, the student is feeling like finally someone's asking me these questions, like almost a sense of relief. So we're glad that the MHAT counselors are there and asking these questions and that we're able to do this work. So, okay, it's you, Jared.
Well, just briefly over the successes, and then we can jump into the Q&A. I think that we're learning that the value of question 24 is critical. If we just focused in on that, I think we're doing great work. And I think even with the mental health services, we're doing great. As I mentioned, we had 85 kids last year, and that would have been higher, probably 140 or so, 150 students, had we not had the shutdown, the school shutdowns, and because we kind of shut, even though we continued with the students that we were working with, we didn't take on any new students last year. So, I'm hoping that we'll get 150 to 180 students this year that we're going to be working with over the time period of time. So that's a lot of students that we're working with. And I think that there's some great work that's going on as well. All right, so we had some questions that people had asked, and we've got only a few minutes to go over that. I think that, Prince, was this you or was this me that I was going to talk about this one, I think?
That's you, my friend.
Okay, thank you. So there was one question or comment about students using cameras and opening up the cameras, have it be a requirement. I agree that we should strongly encourage students to be on camera, but at the same time, we're hearing a lot from a lot of students that their family situation is not optimal, and so having I've 7 to 10 people living in a one bedroom apartment, and so it may be that they don't feel comfortable because they're in a place where they're not comfortable. Even if they can have a background screen, they still don't want to be online as much because of the number of people in the house or the conditions of their environment. A lot of our kids also get up at the last minute and kind of stroll in with bedhead and not with PJs on. And whether that's good or not is, obviously it's probably not very good, but that's kind of the reality of the situation. So as much, I think teachers should encourage camera use, but I don't think that we can require it. Another question is, are there ways in which COVID-induced depression and anxiety are different from COVID, non-COVID forms? In general, depression and anxiety are just a similar process. There's a lot of things that can kind of induce or exacerbate anxiety and depression. And obviously, lack of social connection, which I think is a primary part of COVID, the lockdowns due to COVID, is certainly indicators or kind of drivers of depression and anxiety in a lot of kids that we're currently seeing. There's no differences in terms of like the mechanisms of depression or anxiety, but certainly for counselors working with that, the challenges are much harder. Like for depression, one of the major treatments is what's called behavior activation. And that's kind of getting kids out and, doing exercise, maybe possibly seeing other people. Obviously, with school being closed, it's easier to sleep in. It's easier to stay up all late at night. It's easier to, again, not get out of bed and to show up to class if you do show up at all, to be in PJs and things like that, and not be showered, dressed, kind of taking care of basic needs. So there are certainly some differences, but in general, they're very similar. And then it says, please give advice on concrete steps to take to manage social isolation, feelings of stress, and anxiety. We did a training last night. Lane Barker and I did a training on kind of anxiety management. And I encourage, it's going to be up on our district website. I encourage you to watch that, take a look at the resources. There will be a lot of information in there as to kind of how to help kids with that. Managing social isolation, I think what I find is there are some applications out there that allow kids to have kind of mutual activities to work together for kind of playing games together. The challenge, as mentioned earlier by one of our MHAT members in the quotes from the beginning, is that sometimes that social interactions can be unhelpful as well. It's really hard, but I would also encourage to set up kind of chatting, occasional chat times with kids. Have the computer in a public location, so not in the student's room. I think those can help with supervision and making sure that there's not inappropriate discussions or contents. And then, Corinne, you're going to talk about these questions?
Yeah, so is counseling offered to students in the Bellevue School District? Absolutely. In addition to our school counselors providing brief interventions and solution-focused counseling and small group instruction and counseling for our students, we also, obviously, Jared's been talking a lot about the MHAT services. So that's available to our high school students, and we're hoping at some point in the very near future to be able to expand that to middle school. And then we also have the mental health agencies that are providing services for our students in the school. And those agencies are like Sound and Youth Eastside Services, which is YES, and Consejo Counseling and Referral Services. We also have ACRS, Asian Counseling and Referral Services, and CMAR as well. So we collaborate with those agencies, and I actually meet with those agencies once a month just to make sure that our services are, is what it's needed in the school district for our students. So it's a really great collaboration. So I just want to share that with you as well. The second question is, my son is feeling a significant lack of motivation when it comes to studying or doing homework. With the new set of lockdowns and restrictions, we'll likely be hunkered down in our house, and we're concerned about keeping him engaged and motivated. So I did bring with me some suggestions and recommendations, building relationships with peers and teachers. Hopefully that will continue to help your student be engaged. And for peer connection, some of the virtual type things that are suggested are things like you could brainstorm activity ideas with your child to do during the virtual get together, have a movie watching party over the phone or online, allow some online gaming with interactions, baking or cooking together online, or other ways of, just being able to be social, but virtually. And then playing board games together. And the recommendations are Yahtzee and Battleships are two great games that work really well virtually. As far as the connection for school with teachers, obviously that is really important as well for students to do in order to keep them motivated. So, as parents, you can keep an eye out for school social events and newsletters and teacher communication. Some schools are offering things like virtual recess, virtual lunch bunch, and other ways for students to stay connected. I know schools are still offering assemblies, those types of things, and encourage your students to participate in those things. Encourage your child to engage in morning circles and other classroom schedule connection opportunities is another suggestion. And then support your child in writing emails or letters to their friends or teachers. Sometimes, especially if you have the younger ones, that's a good way to help them stay connected to their teachers. So that is it. I know I don't know if we're way over time, but we're definitely over time. So do you want to do this one, Jared?
Sure. Just want to give some extra thanks to Deb Kraft, who was a former, Princess, the previous director of counseling, Gerardo Martinez, who was also on the MHAT team, Maya Vergeen, who was also there, Georgiana Sedlak from University of Washington, and then Megan, Pei, and Santa, who are UW interns as well. And then we have our contact information there at the bottom if you have further questions. I'm going to stop sharing at this point.
Okay. Well, thank you everyone for joining us this afternoon. And I hope you enjoyed Corinne's and Jared's eye-opening presentation and learned how the Bellevue School District and Bellevue Schools Foundation in partnership are all in for the social and emotional well-being of our students. So thank you, Corinne and Jared, for taking the time to present today. I especially appreciate it, given how busy you are during this challenging time. So thanks all for joining us. And Corinne and Jared left their contact information, but feel free to send me any questions as well, and I will be glad to forward them to Corinne and Jared, because I know we went over time and there were a lot of questions, and I want to make sure that everybody's question get answered. So thank you.